Hi, I am Ali Nisus, registered nurse and managing director of Nice Us Geriatric Home Care Training and Agency Limited, and this is Return the Favor, a web series giving you tips on how to properly care for your elderly parents. They took good care of you as a child, so now it's time to return the favor. Hi, I am Ali Nisus, and this is Return the Favor. So we are at episode 13, and this episode is foot care for the elderly with diabetes. So in episode 8, we looked at the basics of skin anatomy and physiology. So that would really help you in understanding this episode as well. So I would link it somewhere and you can take a look at it, and then come back to this episode if you so desire. But let's get into this, right? So we're looking at foot care today, especially for the elderly person with diabetes. But why is foot care important? Well, let's look at the skin care for feet in order to identify the importance of healthy feet. So in the elderly, feet can be an issue because it's something that you're not fully aware of it sometimes. Sometimes you may have cuts and bruises that you may not have noticed. And this can be an issue, especially for diabetic persons, because we all know of cases where an ulcer or a wound can turn into something more dramatic, and then you may actually lose your feet or your legs, maybe a toe alone. It can be quite dramatic for diabetic persons. So foot care is critical. So skin care is very important for healthy feet. So why? Skin reflects overall health. If you have a certain amount of nutrients in your body will always give the vital organs, your brain, your lungs, your heart, your kidneys, they will give those organs the nutrients first before anyone else gets it. The organ that gets the nutrients last is the skin. Skin, hair, nails, those are not as important, and so they will get the nutrients last. So if you have good skin overall, you are healthy in theory overall. Healthy skin, another reason is healthy skin is the body's first line of defense and the most important line of defense. Prevention better than cure, and that's what skin does. Skin keeps things out. So if it's not in the body, it can't hurt the body. So having healthy skin is important. Why should skincare be important as well? Well, dry skin may cause cracks to the feet, and deep cracks called fissures can be very difficult to heal, and they're also painful, right? So again, prevention is better than cure. Broken skin can increase your susceptibility to infection. Yes, the feet are sometimes neglected because, well, they're sometimes neglected because it's out of sight, out of mind, right? But it is important, especially for diabetic persons, to prevent complications that can just make their life really difficult. And another point I want to make is that diabetics may have hardening of the arteries. So that condition is called atherosclerosis. And this hardening of the arteries can decrease circulation, especially in the legs. Now, in the legs, you have no heart in the legs, right? So it is already a challenge for blood to come back up from the legs to the heart. Remember, blood is circulating all around. The blood that is closer to your heart, it gets circulated with much greater ease than the blood that is further away. So that is why keeping the legs healthy, keeping the feet healthy is important to improve circulation so the blood could come back. When that is an issue, then you have difficulty with the cuts that may happen healing. The blood itself has nutrients, it has oxygen, it has all the things that are required to heal a wound. So if it is already difficult to reach the location, then you'll have issues with healing as well. And remember, the blood has, for those who know and who didn't know, the blood has white blood cells which fight germs. So it's important to have good circulation for healing. And the last point I want to touch on why skincare is important is that routine foot care prevents complications, and prevention is better than cure. So we know now why to keep the skin healthy on your feet. So how can we do this? Step 1, keep the feet clean. And this is not only for diabetics, this is for anyone. You keep the feet clean to decrease the number of pathogens on it. Well, let me not decrease the number of bacteria and fungus, right? So decrease the number of bacteria and fungus will decrease the risk of infection, because if it isn't there, then it can't be harmful, right? So how to do this? You want to wash your feet thoroughly, right? You can use any, I don't want to call any kind of brand name, but you can use any kind of cleansing lotion or soap or anything like that to wash your feet and dry it properly. So dry between the toes as well. Don't forget to dry between the toes, right? Step 2, you inspect your feet carefully, or your parents' feet carefully. And again, between the toes, look for any redness, look for any sores, any wounds or anything like that. And you see a doctor about it, especially for someone with diabetes. Please, that is critical. The old people used to say foot and grave. Yeah, that is very, very critical, because it can turn into something black and unsavable like that. So just be very, very careful of that. And I want you to check out episode 9. So I'll put it up here. For episode 9, we spoke about wounds. So it will help you understand how to identify that wound if, God forbid, that you see one. Right? All right, foot care continues. Step 3, you want to apply a moisturizer. And this is to replenish the skin. You want to use a cream. Oils and lotions may not be as, it may not give as much moisturizing properties. The oil and the lotions may be more of a barrier, that, like for water to just slide off, but a cream itself kind of nourishes the skin as well. So you can use a cream that is specifically for diabetics in order to get that added protection, right? And that's how simple it is to keep the feet healthy. Those are the 3 steps. You can incorporate a daily routine. You can have it morning and evening. You can also incorporate soaks in the routine as well. I think I find Epsom salt soaks can be very beneficial, right? But of course, everything, pass it towards your doctor first to ensure that you all are cleared for that treatment for diabetics. So other important foot care tips: keep toenails short. Use a file to avoid cutting the skin by error with a clipper. So you don't want to use a nail clipper, because you may nick the skin and you don't want to risk any cuts whatsoever. We're trying to avoid cuts on the feet for diabetic persons. So if you have a nail file and you're filing it down, you're not going to cut, right? So use a nail file. And any issues you may have or you may see on your elderly parents' feet, like ingrown toenails or bunions, you need to go to a podiatrist to deal with that. Try not to deal with that situation on your own. Remember, it's a diabetic person. It could be really detrimental if you intervene and it causes bruises or causes cuts. It's going to be very hard to heal. right? So let your parent or the diabetic person wear shoes that fit properly. So if you have a shoe that squeezes, it's going to cause pressure. And we did an episode on pressure ulcers, right? So pressure ulcers can be for persons who are bedridden, but if your foot is in a shoe that is squeezing, it can cause pressure between the toes or pressure between the toe and the inside of the shoe and can cause an ulcer anywhere there. And once there's a cut, that's an issue. Because as well, you have on the shoe, you have on socks, or you may not have on socks. It may have bacteria in the shoe, and that may cause infection. Make sure and dust out your parents' shoes before they put it on. You could have a little Lego inside of there or a coin, and they put their foot in, and again that pressing on the toe, and that could cause and it could cause a dent on the skin, and that's it. That could cause an ulcer, and that can be total failure. So dust out the shoes properly, and you don't want any bugs in your shoes anyway, right? Don't let your elderly parent, the person with diabetes, don't let them go barefoot. It's not worth it. Because of the complications already, you don't want them to be barefoot because that can cause they can stand up on a stone, a piece of bottle, and because there's reduced sensation, remember we spoke about atherosclerosis and the hardening of the arteries and the decreased circulation, that may cause lack of feeling, and you can also get nerve damage from being a diabetic person for a while, neuropathy. So you can have decreased sensation in the legs. They may not feel a cut, and it's only afterwards when the toe getting black then they realize they have a cut. So be very careful of that, right? We spoke about wearing properly fitting shoes, wear properly fitting socks as well, right? So socks and stockings should be fitting properly, not bulky, right? And when you have on socks and stockings, look at the socks and stockings and see if you see any blood on it. You may have a wound and don't know, but if it bleeds, you'll definitely know from the socks or the stockings that they have on, right? Every time you go by the doctor, let him examine your foot. Let them do that. Nothing is wrong with that. And you may have missed something. Something may look red and you didn't realize it was the start of a wound. Something may be even dark people, it may be purplish, bluish, and you thought that was something normal. Now if your doctor inspects it, then you can stop something before it starts. So every time your elderly parent goes by the doctor, ask them to look at their feet, please. And definitely, if you're diabetic, you need to check your blood sugar. You need to control your levels. So if you don't check it, you will never know. Sticks can be expensive. Taking the sugar is very inconvenient. You have to stick yourself. It's painful. Your fingers get numb. But it is important that you know. Not knowing can be a death sentence. So please check your levels. Make sure and follow your dietitian's regime. Make sure and eat according to your condition. Keep active. Drink your water. Take your medication, please. And that will help remedy and supplement, it will complement a good foot care regime. Don't forget to subscribe to get more content like this. And if you want more details on the topic for today, check out the blog on our website. Link in the description. Until next time.